Good evening, ladies and gentlemen. My name is Leon Lidigu. I'm a global health and climate journalist at Nation Media Group, and I'll be your host this evening as we discuss climate change's impact on health. First, I wish to invite Esther. Esther, where are you?
I'm doing well.
Yes.
Rather cold, but I'm doing well.
Okay. Please keep warm as we start.
Thank you.
Our
Yeah.
speaker on our guest on call. Our
Yes, she is. Yeah.
Oh, finally.
The planetary.
Yes,
Planetary.
yes.
Yeah.
Okay, thank you. First, I wish to kindly request her to introduce herself, tell us a bit about herself and what she does. Then we proceed from there. Kindly. I don't think we can hear her. Meanwhile, Esther, thank you to you guys for always hosting us. And I just want to know from an insurance perspective, do you guys have any offers for us? Me, I love offers. I love nice things.
Offers.
Yes, in regards to the climate, they've said El Nino is coming. Is
Yeah.
there anything tangible from the insurance sector that can cushion
Maybe
us
not,
from the
maybe, maybe not tangible yet.
Yes.
Uh, Maybe what I'll just ask everyone is to maybe just check whether they have what you call a domestic package cover or a home insurance cover. If the rains are going to behave as we are suspecting, one of the things all of us always watch out for is whether our property is safe. So in the event maybe you live in a place where it's prone to flooding, and the electronics can get a bit damaged, I would, at this point in time, urge people to consider having a domestic package cover or a home insurance cover.
Very interesting. What does a domestic package cover entail? Actually, before we go back to our guest, I believe she's being sorted.
Domestic package essentially just ensures your valuables at home, be it electronics, your furniture, whatever you choose to include in your domestic cover is insured in the event there is damage to your valuables or your property. So it's very important to adequately insure. I know people may be prone to under insure. Maybe they just say, I just want to make sure my TV and my radio is okay. Sometimes they'll forget they have laptops as well. You have your jewelry as well. So some of these things, if they are valuable to you, I would really recommend that you just insure it.
Thank you so much. Is our guest finally on? So, please start by telling us about yourself first, Diana, as we wait.
Okay. So my name is Diana B. I am an MSc student at the University of Eldoret. I'm pursuing MSc in Environmental Health, and I am also a research assistant for the project SOFIA, Strengthening One Health and Planetary Health in Eastern Africa. And we work with Melvine. I'm the research assistant. She's the project coordinator in Kenya. It's a collaboration. It's a DAD funded project in collaboration with Wurzburg University in Germany and KUHAS, Catholic University of Health and Allied Sciences in Tanzania, Mwanza, and the University of Eldoret in Kenya. And I'm also an associate member of the Planetary Health Eastern Africa Hub, which is a hub that is from the Planetary Health Alliance that is based in the United States of America. And also associate member of Women Leaders for Planetary Health, also from the PHA. Yes, basically that's my small introduction about myself.
So, very interesting. So, I'm just wondering, I see people talking about planetary health. What does it actually mean?
So planetary health is a field. It's a transdisciplinary field that seeks to bring out to the public the interconnectedness between humans, health, and the environment, and the need for humans, animals, and the environment to coexist in a sustainable manner to ensure that the humans utilize the resources in a way that they won't harm the environment, they won't harm animals, and they will use it sustainably. So let's confirm if Melvine is here. Melvine, are you here?
Yes, I'm here.
Yeah.
Hi, everyone. I'm so sorry. I've never been into Twitter space, so I had challenges.
It's
But here
okay.
I am.
Good evening. How are you?
I'm doing fine.
Okay.
Thanks.
Would you kindly start by introducing yourself and perhaps tell us a bit about yourself?
Okay. I'm Melvine Otieno, based in Eldoret, Kenya. I'm an environmental health scientist by profession and the founder of Planetary Health Eastern Africa Hub. Aside from that, I've also been actively engaged in the climate change as an activist here in Kenya. And I've worked closely with the German Alliance Climate Change and Health in Climate Change initiatives. And I'm also a lecturer at University of Eldoret, an assistant lecturer at University of Eldoret, whereby we are currently working on the Sophia project Diana B mentioned earlier. And also, since I've been in this planetary health space since 2019, and I've been supporting the Planetary Health Alliance as the next generation fellow, supporting young leaders in planetary health across the globe. It's really nice being in this space, and I'm looking forward to our dialogue and discussions. Thank you.
Okay, thank you so much. Now, I was asking Diana B what planetary health is all about. Many of us just hear that term and we really want to know it.
Yeah, just to add on what Diana B had mentioned, actually, planetary health is a new discipline, and it's a scientific field and a global movement focusing on understanding and also basically quantifying the growing human health impacts of anthropogenic global environmental change, and also developing solutions that will allow humanity and the natural systems we depend on to thrive now in the future, because our future generations are really dependent on what we do at the moment. That's why we need this to bring everyone on board to tackle these issues of planetary health, including the climate change issues. And you find out that aside from that, this planetary health concept itself, it maintains a sharp focus on human health, but at the same time, we need also to integrate other concepts like the One Health concepts, which also brings on board us taking care of the animals and so on. So, in other words, if we harm our natural system, we harm ourselves and our future generation. Thank you.
Thank you. Interesting. It's interesting you also mention animals because there's a report by Traffic that was done last month, and it was saying that we are doing so badly as a continent in terms of surveillance on zoonotic diseases. And if we may remember during COVID, there were stories at how the Nene originated from bats and all those things. So, should we, as human beings, be very much concerned in terms of health on how we take care of animals in the event of the climate crisis?
Yeah, I completely agree. We need to take care of it because, in East Africa, we are known to have biodiversity. And according to UNEP, we realize that we really need to focus on how we protect the animals. So we have a number of conservancies, especially, for example, here in Kenya, in Tanzania, and Uganda, that if we completely start affecting or we deteriorate the habitats of the animals, definitely they will lack places to stay and they'll want to associate themselves closer to human beings. And that's why we saw with the COVID-19 pandemic, now a bird that affected, as in that was tampered with in Wuhan, China, spread, resulted to COVID-19, which spread across the globe. So if we don't live properly with the wild animals and so on, and animals generally in a conducive way, then definitely we will get affected. So that's why we need to protect not only the environment, but also to protect the animals themselves, especially those animals that we don't feed on, Yeah. So that's why one health concept is really, really important. And that's why we need to have more education on these concepts so that people are enlightened.
When you
Thank
say
you.
concept, what do you mean?
Actually, One Health concept is an approach that recognizes the health of the people closely connected to the health of the animals and the shared environment. So I can just give like a simple example. The way at home in our villages or in our rural areas, the way the setup is, we find out that we rear chickens, we have dogs, we have cats around, and we have the environment that we live in, and we humans, we stay with them. So if we don't see a way that these animals are taken care of, definitely we'll be able to get these zoonotic diseases. So you find out that this One Health concept has several components: the human, the animal, and the environmental health concepts, as in that are closely intertwined. So that's why we need collaborative and also transdisciplinary action in line with the planetary health, so that we can tackle these issues together. Thank you.
Thank you. So, in relation to climate, what seems to cause diseases and, let's say, insects and all these things we are seeing jump from animals to human beings?
Yeah, what causes is the way we as humans, we are, as in, like, you find out that due to, let's say, for instance, in Africa, there is high rate of poverty. So we intend to encroach the natural ecosystem for survival, because we see that we have lack of jobs, and in Africa, in most cases, 75% of the population are the youth. So you find out that if they don't have job opportunities, definitely they'll encroach the natural ecosystem. And also, when I talk about the natural ecosystem, I mean the forest, the rivers, the lakes, and so on. So if they're really encroached, and as a result of it, we intend to now get affected by these diseases. Because, for instance, a good example is the case of malaria, for instance. So you find out that if we allow our environment to be unhygienic, dirty, and so on, then and maybe we have more, because we normally do practice a lot of agriculture due to high population rate and so on. So we intend to have lots of these mosquitoes harboring in those places, and in turn we get these diseases. But if we strategize ways of doing things aside from clearing of land carelessly and so on, that's why we need to work hand in hand also with the policymakers and so on to handle these issues.
Right, interesting.
Thank you.
Now that we are preparing for El Nino, as the Ministry of Health and the department have all announced, is there
Yeah.
a possibility that we can have a rise in zoonotic diseases due to flooding, for example? And what should we do to protect ourselves?
Yeah, of course, flooding situation has resulted to a number of diseases. Especially, you find out that people will be able to get the vector-borne diseases as a result of these mosquitoes or ticks and so on. And also, we find out that there will be cases of respiratory, because, in cold regions, maybe people will be more asthmatic and so on and so forth. So it is high time we see ways of, but we also have these ways of managing these flood disasters in instances. So in case now that is coming up, and I think more training needs to be done among children in schools, especially to know how to swim and so on, because you find out that other health effects that comes with it is drowning and trauma, especially now that climate change is a gender-sensitive issue. So we find out that women also incur the mental health issues as a result of anxiety, depression, and maybe the stresses that comes with the flooding situation. So we need to create more awareness. And also, we need also to improve our healthcare infrastructures, because if our infrastructures are disrupted, then it's gonna be chaotic. We don't know how we can go about it. That's why the Ministry of Health are really trying as much as possible to improve the healthcare system. And at least at the moment, Kenya is really working closely with the international communities to sort this, to improve this healthcare system through several projects that are ongoing.
Now,
Thank you.
interesting. Yes, you've mentioned the Ministry of Health. And I was speaking to the Ministry of Health last week during an interview, and they told me
Yeah.
something interesting. They said that they are also preparing how to tackle mental health issues that will result from the changes in climate and the distorted ranges of El Nino, because the Met predicts that, unlike previous cases, we are expecting rain that will have an ONI of 2.0 when during the 1997 El Nino we had an ONI of 2.4, which is closely almost at the same intensity of rainfall we'll be experiencing. That is too much rainfall.
Yeah.
Now, what is the relationship between these climate changes and mental health?
Yeah, the relationship between climate change and mental health is the impacts is it comes with it. So for instance, imagine somebody who was just living well in their own houses, then all of a sudden due to drought and not drought, I mean flooding and El Nino occurring, then their houses are submerged in water, then they have to be displaced, And imagine somebody also who is living in a mud house, and you know how the madhouse is. Whenever water comes, then definitely the house is down. So you find out now relocating from one place to another is a very this it's a very tormenting situation and scenario. And now you find out that women being people who are taking care of the households and taking care of children in most cases when men go out to work and so on, especially women who are the housewives, for instance. So you find out in most cases that the ones who have this stress that comes with it, the mental health stress, because they need to figure out how will my child eat, or how will my family sleep in a proper place, and then if you remember there is mosquitoes and you know where to sleep, such kind of scenarios, it's really detrimental. And at the same time, we know very well in Kenya and other African countries, in most cases, mental health isn't a priority. People don't think it's a disease, So there have been less investment in mental health facilities and also mental health practitioners. So I think the government and the Ministry of Health really need to work on this and create employment and education opportunities for mental health practitioners, so that whenever disasters occurs, that as in this El Ninos and flooding situation occurs, women and children who are in distress can be able to be sorted out and helped, But we are far behind in Africa, so we need to pull up our socks and figure out how we will work together to tackle these issues. Thank you.
Thank you. And the reason I asked that question is because this is usually a forgotten aspect when we talk about the losses and damages that come about with the climate crisis. And
Yeah.
according to the American Psychological Association, and they were asking, is climate grief something new? So they explained that conceptualizing the losses and anticipated losses associated with climate change is relatively a new proportion. Like, this thing has been there, but we just didn't know it was there. Yeah? I don't know if you guys are getting that. Now, there's something called, now they're calling it ecological grief, or climate grief, or eco anxiety. So you be on the lookout. For some people, they're going to experience El Nino for the first time. They'll be wondering, especially children, they'll be wondering what is going on. They can no longer go out and play. These things affect their mental health. So it's important you just be on the lookout, and be your brothers and your sisters' keeper. Now, in line with health, Melvin, I want to know something. I want to know why Africans should prioritize planetary health at this challenging moment of our time, and the effect climate change is having on the larger aspects of health.
Thank you so much for that question. Actually, Africa really needs to prioritize planetary health because Africa is disproportionately the most vulnerable region in the world affected by climate change. And this is also due to lack of resources for adequate mitigation and adaptation. And I'm very grateful during the previous events that happened here in Kenya, the Africa Climate Summit, and also the COP28 and so on. We've been discussing a lot more about the mitigation and adaptation because there is really a gap in that. So you find out that due to lack of resources and for adequate mitigation and adaptation, you find out that in these African settings, the poor are disproportionately affected by climate change. And also, not only the poor per se, but also we see the disabled, women, and children are the most vulnerable groups. And despite also these realities, you find out that Africa also contributes to the global initiatives and also commitments for climate action. So as a result of that, we see that Africa has really played a significant role in the creation also of the human activities and based on the exploitation of the ecosystems and so on that has led to these severe environmental consequences. So in other words, so the Africans really need to prioritize planetary health concept, which is a transdisciplinary concept that not only requires people from the environmental health side or discipline to tackle these issues, but we need to bring other people on board. That's the reason as to why we need business people to be on board. We need people from the creative arts, the musicians, the dancers, everyone to be on board. We need the doctors to be on board. We need the youth. We need women. We need the indigenous populations. We need students. We need the educators to be on board to tackle these issues. And that's why we also need to work hand in hand with the community to tackle these issues. That's why we really need to prioritize this concept that is really diverse and also synergize with the One Health in order to save our planet. Thank you so much.
Thank you so much. I'm very happy and excited you mentioned COP28, because a few months ago I had an exclusive sit down with Dr. Sultan Al Jaber, the current COP28 president, and he told me that for the first time we at COP28 we are going to have a whole day to discuss health, like a day set aside to discuss health. What does this mean for us? For the first time at a climate conference, we are discussing health.
I think for us, it means that we need to avoid working in silos and we need to be aware that this climate change issue is real. And if we don't focus on our health status, then our population, we are going to perish, and our future generations are at stake. So that's why we really need to prioritize health aspect at all sectors. And that's why I'm really grateful at the moment. There have been lots of other African conferences and international conferences that people need to work closely together instead of different sectors or different stakeholders working on their own. So I really like that idea, and I'm looking forward to what comes about in the next COP in December. Thank you.
Just to perhaps a follow-up question on that. Do we really as Africa prioritize health? Because just the other day, if you look at the Africa Climate Summit, as you have said, we discussed issues on health, yes, But when it came to the Nairobi Declaration, there was totally nothing about climate and health. Do our leaders care?
Yeah, actually, we we haven't been prioritized health. That's why we need to foster health equity in the context of climate change action. So by this, we need those people working in public health organization. They can participate in many climate change policy and planning processes that are now underway in other sectors in order to bring the health lens to the table and also advocate for the climate action and also promote this health and equity. Because we find out that if we talk about policy work, you find out climate change policies and strategies are also very important opportunities to prevent the catastrophic climate health impacts and also the shift that comes with it, especially when we talk about the social determinants of health. And also, I feel like it's really important the human resource to be increased because there is less human resource, in the public health professionals. Because you find out there are people who have done public health professionals who are doing completely different jobs because of the way our job settings is. So you find out that these public health professionals have the credibility on prevention and health with the public and policymakers. So if they can basically communicate the importance of climate change and human health impacts and inform about opportunities for health co-benefits, then we see that participants, especially in public health, can unify a framework that can multiply climate change goals and counter the perception about climate change. So these messages should really be clearly explained and highlighted in the current connections. That's why we need to have more of these discussions on how we need to integrate health in all aspects. Thank you.
Thank you. And just to pick your mind a little, because you've mentioned policy, I have covered health for like 6 years now in this country.
Yeah.
And every year the government is always launching policies. Lakini ukienda kwa ground vitu ni different. Where does the rain beat us?
So I feel like the rain beats us because we have pressing challenges in bridging policy gaps between climate change and health in Africa. So one of the challenges that we are faced is the funding challenges, you know, and this is a major challenge for health adaptation because you will find out in most cases they haven't prioritized budgets to tackle this climate change and health. And in most cases, in that scenario, then you find that research funding to understand and manage the health risks of climate change is even smaller than 1%, for instance, of adapting the funding designated for health. So the rain beats us when it comes to funding. People switch funding to other things, and we forget about the health scenarios that comes with climate change. Another scenario that comes with it, specifically another challenge, is the unstable governance mechanism. By this, I mean that the government mechanisms that support actions to reduce climate change risk are challenged by diverse and complex drivers. You find that there are a lot of issues we need to handle, and people tend to forget about the crucial issues that we are faced as a result of climate change. So I always feel like the national health authorities can play a fundamental role in adaptation by putting it on the agendas of subnational partners so that it can enhance capacity through legal framework and also with financial resources. The way they distribute funding for making roads and so on in different counties, that's the same way they need to source out funds to support grassroots projects that aligns itself with the climate change and health. And through that, it will be helpful for even creating awareness to the community. But there is a really gaps in that. That's why the rain started beating us from. Thanks.
Thank you. Which brings me, I would love to pick your brains on universal health coverage as we are talking about planetary health. Kenya has failed at achieving UHC 3 times. In fact, Nakumicha says this time round it will be our fourth stab at UHC. Today we saw the president launching over 100, I think, CHPs, people they are calling community health promoters. These are basically people who will be paid 3,000 to 6,000 shillings, watakuwa mashinani na gadgets za kutaka kumesha heartbeat, kutaka kumesha nini,
Yeah.
wanakusort mbio. But I feel like it's a shortcut to the bigger problems that we are facing in this country. We even don't have drugs as we speak. KEMSA themselves last week told me we don't have any drugs. That the KEMSA of yesterday gobbled up everything. We even spent 1.9 billion shillings buying COVID commodities that we no longer need. We even banned HIV antiretroviral medication that have expired and some regimens we don't need because we have new modernized regimens.
Yeah.
Why do we get it wrong every other time we are dealing with universal health coverage?
I feel like since universal health coverage, especially here in Kenya, it basically aims in ensuring that all Kenyans have access and receive quality health services without suffering financial hardship. So you find out that in most cases we require services like the preventive, the curative, and so on. But you find out that if you are a poor person in Kenya, then basically your days are numbered if you have, let's say, these diseases like cancer and so on that requires a lot of money. So I think the government or at national level, they need to figure out how they could work together with the international communities and maybe do benchmarks in other African countries on how to improve the health system performance. Because this issue requires also global efforts. And especially, we need to look into the three pillars, especially the service delivery, the health financing, and the governance. So, if we look into that, then it's easier. But we have also underlying factors, that comes with it. We are having high population, so we also need to look at how we manage our population, because also with poverty increase, then definitely the government or the Ministry of Health will be overwhelmed. But there are lots of funding that comes from there, but I don't know what happens in most cases, that it doesn't reach out to everyone, as in like to be able to get this to get their healthcare covered. And also, if we talk about the insurance company, I think also we need to figure out how we support the low income people who earn low wages, so that at least their healthcare can be improved. So there is a lot to be done as a country, and also we need also not to look into the problems, but also more on solution. Look at what is happening in other countries that have amazing universal health coverage, and try to learn from them. And that's the only way to go. And also seek um, more funding opportunities, maybe at global level. Thanks.
Guys, by the way, I'm open to taking your questions. If you look at the right hand side of your screen at the bottom, there's a heart-shaped icon. If you click on it, you'll see an emoji for raising your hand up. Please do so, and also request for the mic. I'm sure Joy will be able to sort you out so that you ask your question. But talking of questions, I can see who is this? I can see Manasi Kumar, who's a clinical psychologist from the University of Nairobi. She's saying that poor countries and communities experience severe stress and challenges. I don't think ecological grief and anxiety may be milder forms of mental health disabilities. We need to understand African or low middle income countries, their needs and responses better. And then she says, great question around defining planetary health. Also focus on other species that live on Earth. What are the emerging climate change associated challenges impacting health? So, Melvin, I hope you're noting those down. Um, what do you think are the emerging climate change associated challenges that are impacting health? For example, we've already talked about the mental health aspect of it. We've talked about waterborne and vector-borne diseases. Perhaps you would just love to know, are there any others?
Yeah, thank you so much for that comment and question. So, for other emerging climate change issues, aside from the mental health effects and so on, we see that there are also cardiovascular diseases that comes with it, the heart diseases, and we also have the respiratory diseases like the asthma and so on. And we had already also
Allergy.
talked about, yeah, and we had already talked about zoonotic diseases, but we also have, depending on which climate change impact, let's say, for instance, if it's a situation like flood, as in a drought, for instance, you find out drought causes heat strokes and other skin diseases that comes with it. And also there is the aspect of malnutrition that comes with it, you know. And another scenario is the trauma that comes with this aspect of climate change impacts. So that's why we need to really, it depends with what kind of case, as in like what kind of um, effects of climate change that comes with it. So if it's air pollution, then it has lots of issues, like I'd mentioned, allergies, cardiovascular and asthma and so on. And if it's extreme heat, also there might be some instances of even death, you know, if somebody uh, gets extreme heat, especially it can affect children also. And also there is other issues that comes with, let's say, the wildfires and so on. You find out that there is lots of injuries coming with it and a lot of casualties. So it's really, there are really a lot more of health effects that comes with these impacts of climate change to human health. Those are just some of a few that I've mentioned.
Thank you. Now, the United Nations Intergovernmental Panel for Climate Change, that is the IPCC, says that the Paris Agreement explicitly links climate action with a healthier environment, from cleaner air and reduced risks of extreme heat waves to keeping in check with the spread of diseases. Now, let's talk about air pollution because at the United Nations General Assembly over the weekend, I saw the First Lady of Kenya pledge to empower 2.5 million Kenyan women with clean cooking technologies. And she said that we are having a lot of spirometry issues in terms of health, especially with children and mothers. I'm sure you've seen on the news, you've seen those news items or features of children in Kibra and Makadara, and their parents are cooking using plastics and they are coming dripping with blood, dark mucus. How does air pollution now affect health in this regard?
Thank you so much for that question. So, talking about air pollution, it has resulted to a number of, is associated with a number of diseases. We have heart disease, the stroke, lung cancer, and also even the mental health illness. And to women, it even causes miscarriages. So you find out that, as an example, in most Kenyan cities at the moment, suffer from serious lack of air quality, especially big cities like Nairobi. You find out that the reliable air pollution exposure information are really scarce in Kenya. And in this instance, you find out that people are really congested in their houses and so on. That's why even if you look at one of the causes of for instance, COVID-19 scenario, people are told to live in ventilated houses and so on and so forth. But imagine those families who have many children and they are living in a small house that isn't well ventilated and so on, and they are living maybe in these big cities, and there is no maybe let's say tree around, because you know how the constructions are in Nairobi, for instance, places like Pipeline, how congested it is, and you can imagine how it can cause these kind of diseases. So you find out that according to WHO, outdoor air pollution really, there is a lot of outdoor air pollution that has really resulted to adverse health effects. So we really need to check on that, and that's why we need more research to be done. And if you talk about generally, nearly a million people die from air pollution in Africa alone. That is according to statistics in 2016. And you find out that the people who are mostly affected are the children, women, and older adults, and the poor who that are the mostly impacted. Because you find out that women tend to use this, especially women in the rural areas, are still using charcoal and firewood for cooking, and they stay there in long hours carrying children while cooking at the same time. And you find out that this dirty air remains a leading risk factor for early death in Kenya, So you find out that also we have, let's say, more than around, according to statistics, premature deaths of around 18,000 people every year in Kenya are linked to air pollution. And this all figures is all according to the WHO. So this really needs to be looked into, and it is not. And air pollution also is a silent killer, especially through the dust, especially when we experience drought situation, or maybe when we don't experience rain. Then the dust particles also are another scenario whereby it transfers lots of air, as in air pollutants that are really toxic to us. So we find out that it has resulted also to a number of premature deaths worldwide. So we need it. I feel like a lot more research needs to be done on air pollution aspects. Thank you.
Thank you so much. Now, just to try and understand this, you've talked so much about policy. Now, I'm wondering, how do we bridge the gap in Kenya between science and policy? I can tell you this week, I'm currently in Homa Bay, and I've met women who are telling me how the lack of fish in the lakes due to the climate crisis is driving them back to sex for fish. If you look at our HIV rates, they're spiraling. So, how do we harmonize policy and science? How do we bridge that gap from your expert point?
Yeah, I feel like the way we need to bridge the gap between science and policy is that whenever, let's say, people from institutions like research institution, universities, whenever we do research, we need to go back to the communities and disseminate our research findings. And also we need to bring the policymakers and tell them, maybe share our recommendations for our research findings. Because a number of instances, you find out people finish doing research, they publish, and it's seated there. So we need to figure out how do we communicate our research findings in the most simpler way that community and the communities and also the policymakers can understand the findings, so that for that case it can create more awareness about it, and also to enable the policymakers also to review their initial policy depending on which thematic area they are being involved in. So we need also to also focus more on this knowledge dissemination transfer process, because a number of research people, after they have done publishing and research is done, that's the end of it. It just appears for only people who can read, and not everyone can read things that are posted online. So we need to synergize how do we communicate back these research findings to policymakers and also to the community at large for for further awareness creation.
Now, which brings me to my next question. What role can youth and gender play in bridging policy gaps and ensuring a resilient and healthy future?
So talking about the youth, I think this is one of opportunity that Africans have, because 75% of the populations are the youth, and now for them to tackle and be part of bridging the gap of the policy gap, you find out that young people can actively contribute to decision making, because they can create their own avenues and promote the value of intergenerational justice and equity. So you find out in most cases, the young people can demonstrate their strengths, for instance, because they are social media savvy, because like for instance, here in Kenya, many people are on TikTok, they're on Twitter and so on. So instead of putting negative energy, the young people have the ability to connect across the generations and countries, and step up and act when we are being faced with these environmental or climate change issues. And you find out that due to the urgency that we have on climate change impacts, so and we have variations in understanding on how to adapt the climate change issues depending on different region, we find that young people have a reasonable understanding of key climate change impacts on how to be on how to inform the actors, and also in resilience building and so on. So I think they should be given an opportunity for their voices to be heard, and I think they need to be supported. And I think there is an ongoing other very active climate change activists out there who are really working hand in hand with other young people to tackle these climate issues. So if we talk about the gender aspect, I quickly think about women, because it is also important to consider, because women are the most as in climate change is a gender sensitive issue. So I feel like it is important to create active and vocal spaces for participation for young women in politics, and also enabling environment for them to act and work closely with the community. So they really need to be supported. And you find out that, for instance, at community level, there is also need to create networks where young women can learn, share, and empower themselves, and also acquire mentorship to handle the risk that comes with different impacts of climate change.
Very
Thank
well.
you.
Thank you. Now, you founded the Planetary Health East Africa Hub, and I just want to understand, considering also the broader Planetary Alliance you're part of, what is the role of civil society in solving climate action with regards to planetary health?
Thank you so much for that question. So I feel like the civil society have a very big role to play, because they bring different actors together to tackle these issues. And Planetary Health Alliance as an organization is a diverse community of around 1,700 plus individuals and around 350 plus organizations from 60 countries who are committed to understand and also address the health impacts of global environmental change through community building, research, education, mainstreaming, and action. So as part of the Planetary Health Alliance, we have the regional hubs, and we are lucky we have an African regional hub, Sub-Saharan Africa, and we have a number of it. So we have the West Africa Hub and the Eastern Africa Hub that I founded together with my other colleagues. So you find out that we aim at aligning our activities with the PHS mission to mobilize, promote, and lead to lead diverse science stories and solutions, and also communities to achieve the great transition of these planetary health issues. So you find out that the civil society generally foster collaborations across disciplines, and also by bringing people and communities together and working groups together. And also they offer opportunity to convene and empower the next generation of planetary health leaders. By this, I mean young leaders who advocate for these climate change issues and so on from across the globe and across the region so that they can tackle these issues. At the same time, the civil society will support in maybe education aspect. Like for instance, with the Planetary Health Eastern Africa Hub, we saw there is a gap in knowledge about planetary health and climate change. That's why we are, through our Sophia project, we are trying to come up with the planetary health toolbox that will help universities who want to review their educational curriculum to be able to disseminate the latest planetary health science, innovation, and inspiration from different people who are working on these topics, and through that, we'll be able to work hand in hand together with other institutions who have the same mindset to tackle these issues. Thank you so much.
Thank you. Now, with regards to planetary health, Dr. Tedros, the boss at WHO,
Yeah.
is on record saying that, and I quote him, climate change is already impacting health in many ways through more frequent and extreme weather events, more disease outbreaks, and more mental health issues. Flagging the impact of climate change on various aspects of human life, including disease and malnutrition, he calls for the government to lead what he describes as a just, equitable, and fast phase out of fossil fuels and transition to a clean energy future. So, what is the correlation between fossil fuels and energy and planetary health? And how do we achieve this? Because we've been seeing President Ruto equally say that we need to go green, we need clean energy. How can you connect the two for us kindly?
Okay. To talk about the fossil fuel aspect, we found out that the global north, people from the global north have resulted to they have a lot of industries that has really impacted to climate change. And in this case, planetary health focuses on policy work by the health sector to drive the decarbonization, which are often centered around demand side interventions, seeking basically to reduce the consumptions of fossil fuels via transfer of lower pollutions options, let's say in terms of energy, food, and transport. And you find out that having had experiences of visiting countries in the global north, for example, I've visited Germany, I've visited US, and comparing with how Africans how we are it's called what we are polluting the environment through fossil fuels. It's totally different. So you find out that people in the global north, they're using lots of flight, like in the US, going from one state to another. Like I traveled from both Boston to Atlanta, Georgia, and I just felt like you have to use a flight. And if you are in Germany, for instance, there is tram and train, so they have to use excess of these fuels. And if we compare, they are trying also to come up with a solution. So for them, we find out, like a case scenario in Germany, they are promoting more of cycling. The way their roads are designed, you find out students, young people, old people are all cyclists. But if we come back to Kenya now, or other African countries, you find out that people feel privileged if they own cars, and they don't know that these are resulting also to the environment. So right now, like for instance, in Nairobi, a city like Nairobi, a city like Lagos in Nigeria, for example, you find out that there are lots of cars, even more than human beings. So we need to synergize a way that we need to revert back the excess fossil fuel. So we need to create more awareness about the sustainable ways of coming up with improving our transport system in such a way that it can be sustainable for our environment. So we need to promote more of cycling rather than promote more of people driving. But with this, we need to improve our road system so that it can contain people, not only cars alone to be the ones that can be used on roads, but also we create roads for passengers, roads for the cyclists. But in Africa, and an example here in Kenya, at least our government slightly improved on the footpath for people to walk, but now we still need more cyclists. We need to use more of the bicycles rather. So we really need to watch out. So thanks. That's my contribution on that,
Oh, thank
based
you.
on my experience.
Thank you. Now, as we go on, you've rightly mentioned what the global north is doing. They're the biggest polluters in the world. In fact, as we
Yeah.
contribute to a very negligible amount of emissions, yet they're the same people who have refused to pay loss and damage even after we had the civil societies pile pressure until they created a loss and damage fund in Sharm el
Yeah.
Sheikh here at COP27. Now, among in that meeting and also at Africa Climate Summit and also at UNGA, we have seen a lot of talk about international collaborations and partners, aid in prioritizing health in climate change actions in Africa. How are we going to leverage on them? Because for example, President Ruto signed a deal worth 800 billion for electric buses. I'm waiting to see that. We always see these big promises. America promised us a lot of money they have never delivered today. Until today, after Obama, we clapped so heartily for Obama. Some of these are not materializing, and our people are continuing to die and grapple with the impacts of the climate crisis. And at the moment, even air pollution is killing more people, and the number is being equated to it's almost as equals to the rate at which non-communicable diseases are killing people. How are we going to leverage on that?
Yeah, thank you so much. Talking about loss and damages, you find out that climate justice demands a lot. So climate justice demands that we need changes at global, regional, and national levels. So we need a paradigm shift from energy systems based on the fossil fuels that we discussed earlier, and also to come up with more sustainable renewable energies like wind and solar power. So in this case, we also need the people who are responsible for causing the crisis be accountable. And you find that most people that are affected must get this adequate support to adapt to the problem and mitigate. So in other words, the international collaborators or partners, we need to engage them in resource mobilization. So based on the networks that we have, like you had said, our president got some big funding. So we want to see the action point on what this funding is going to handle, because there's a lot to do with the climate change. So we need the support of international public finance institution, which will play a vital role in ensuring that there is progress in the energy transition, and also contributing to the crowding of the private sectors. And we need also them to provide this support, especially for us to be able to focus more on the climate change and adaptation and mitigation, especially in the health aspect. So as also now part of the climate justice demand, we see that we need also a worker-led justice transition. By this, we need to rewrite our system in a way that addresses injustices, poverties, and inequalities. So, for instance, we need education system to be changed in this way. We need in all African institutions to also learn from others. That's why we as a hub, we are really trying as much as possible to reach out to institutions to enable them to review the educational curriculum, so that we cannot learn about climate change if you're only somebody who is focusing on environmental health aspect, but somebody who is doing engineering, somebody who is doing other courses that are not related quite with the environment, to also learn more about climate change. It can be done at undergraduate level or at postgraduate level. So we need system change. So another thing, we need also the indigenous communities, because we know that the indigenous communities, there is a lot to learn from them, and that at the front line as they continue to pay the price of the climate crisis while the global not profit. So in other words, this loss and damage must be compensated. So we really need to work hand in hand with the international corporations to tackle these issues. So through resource mobilization, I think that's the only thing to do, because we need to have climate finances being secured. Thanks.
Thank you. Now, my final question to you this evening. Um, as much as we are grappling with the climate crisis and all these things, we still have some people who are climate deniers. You see them, perhaps you've seen on Twitter hashtags like climate scam. You've seen hashtags or rather, you've seen tweets and posts of people denying that they don't exist. Do we have a problem in the way we communicate climate and health? Because back here in Mashinani, I can tell you for a fact, people know that climate change is real. And those who may
Yeah.
not know something is happening. Something is happening. So, finally, how should we communicate?
I think this climate change topic needs to be communicated depending on different regions, because you find out, like, for instance, like Africa, for instance, people from the East Africa community, we have other countries that speak Swahili. West Africa, they have their own special languages. So we need to come up with people who can translate these issues in a very simple language, depending on where they come from, or maybe we can translate in our own local languages to enable even somebody who doesn't know how to speak English to be able to understand. Like I like giving an example of Germany, because I've visited this country severally, and they don't only speak English, but they speak they use their German language in all, in schools, at workplace and so on, and they translate policy into German, everything into that. Why shouldn't we also try and use learn from them, and also be able to communicate further to our community? So we need more human resource for people who will be actively engaged in translating languages. And then another aspect is, maybe after doing research finding, maybe for the institutions and as in research institutions and universities, they also need to come up with ways of disseminating this research findings in a simpler way that the general public can understand, you know. And another strategy of communicating climate change is through creative arts, you know. So like through the Planetary Health Eastern Africa Hub, in 2021, we did an amazing project with the dance choreographer here in Kenya, in partnership with the indigenous communities, the Maasai communities and the Lake Bogoria communities who are affected by flooding and drought situations. So we need to use our talents as well. So there is a way of communicating through arts, and we've also been partnering with some colleagues in Germany who knows how to draw, to communicate these aspects. So you find out that creative art is really powerful, and this is a way of communicating, because we all love listening to music. So musicians needs to be on board and start singing about climate change impacts, so that it can broaden, it can be more, everyone can be able to learn, because since we love music and so on. So if we use these musicians and inform them about these issues, and they can see a way of communicating through songs, then that will be helpful, and we'll be able to reach a broader community. At the same time, we'll be able to tackle these issues as a whole. That's why, because it's a serious issue, and people take it as a joke until it comes to their doorsteps. Thank you.
Thank you very much. And that brings us to the end of today's session. Now, before I go, let me just read some comments from the comment section. Manasi Kumar says, my concern is also around exposure to plastic, heavy metals in Kenya. We need more nature-based solutions that can be scaled. Plus, environment experts need to translate findings from their field to connect with public health, economics, and everyday concerns of people. Public health too needs to learn from the environment experts. Basically, more synergies are needed. And then ESD Guru says we need to understand that the climate crisis is a health crisis. That's a perfect way to end this evening. Thank you, ladies and gentlemen. It's been real, and a big thank you for to Minet for hosting us. Thank you, Esther. Thank you, Damaris, and the entire team. Thank you to our guests, and have a blessed evening.